All right, no more math today, I promise. Our next lesson is going to be centered around activity-based costing, or ABC for short. And we'll use this section to describe how activity-based costing can be used to understand the true costs that go into a company's processes. So we'll talk about why traditional costing methods don't work as well as we'd like, and we'll get into how and why ABC can help solve some of those pain points. To start the conversation, we need to understand why we should even consider using activity-based costing in the first place. And the reason for that, quite simply, is because traditional costing methods tend to fall short when it comes to understanding the real costs that businesses take on. Now, I'm not knocking traditional costing, and I think it's actually a good starting point, especially for startup companies or maybe a company who's just at the beginning phases of trying to analyze their costs. But it certainly doesn't meet the mail for a mature organization, and there's a couple of reasons for that. First, under traditional costing methods, the tendency is to allocate overhead costs evenly or spread them out evenly across the organization, whether we decide to allocate those costs per patient, per department, or per service line. When it comes to traditional models, it typically means that we're figuring out our total overhead costs and, again, spreading them evenly across those different units that we identified. So if total overhead for the entire organization is $1 million and we have 5 different departments, each department absorbs 200K. It's pretty evident, especially when you consider our last lesson, that this is way oversimplified and it just simply isn't accurate. So as a result of these inaccuracies, it's not uncommon in the healthcare field for high-cost procedures to subsidize lower-cost procedures. Put differently, more expensive treatments help cover the lower costs of lower revenue or otherwise underfunded services. And depending on the visibility that a company has into its departments and the underlying data, they might even be doing this unknowingly. Either way, the net of it is that we run into situations where we have inaccurate pricing for our procedures. And that's because the actual cost of providing a service isn't getting reflected in the price. And if we continue down that road, it means that some procedures are ultimately overpriced to make up for those underfunded services. The last reason that these models tend to fall short is because if we don't have accurate data or a good way to interpret good data, senior management gets very little, if any, visibility into which activities are actually driving their costs. You might have heard of the saying GIGO, garbage in, garbage out, and that definitely applies here. If we can't leverage our data to lead us to better decisions and higher levels of efficiency, then we're putting ourselves at a huge disadvantage in the market. One of the best solutions for the problems like we just mentioned is activity-based costing. Whereas traditional costing uses pretty broad cost drivers, things like patient days in terms of how long they're staying, or patient charges, activity-based costing provides more precise cost allocation that's based on actual activities and resource usage. So we're looking at the underlying things that are ultimately going to result in expenses or cost to the company. Think about things like nurse time with each patient, lab tests that get requested and run, and similar quantifiable metrics. There's a few key benefits that come along with using ABC in practice. First, better profitability analysis and analysis at a much lower level than traditional costing methods can provide us with. We're able to identify which service lines, departments, teams, or doctors are the most profitable throughout an organization. On the other side of the equation, we can also identify, again, which service lines, departments, teams, or doctors are the least profitable. And when we compare, we can find out if any of those situations exist where certain departments or service lines might be subsidizing others. Most organizations that use ABC tend to spend much more of their time on the second bullet, on the problem children, if you will. Once we identify any underperforming departments, we want to look for different ways that we can help raise their level of profitability. And there's a couple things we could do. It might mean cutting costs in that department to boost their bottom line. maybe providing training opportunities or new technologies that boost productivity of the department, or in the most extreme cases, maybe we sell off or just cut ties with that service line altogether. We try to avoid that last option when we can, but there might be certain cases where we need to go to that length. At any rate, our goal is really to try to increase profitability while also making sure that we at least preserve and hopefully improve the quality of care that we're able to provide to patients. The last major benefit of ABC is that it can help us improve our reimbursement strategies when it comes to those third-party payers. If we have a service line with very low profitability, we might do some further analysis and figure out they're actually performing very efficiently based on what's being expected of them, based on demand. The issue might simply be that the organization or that particular department isn't receiving enough revenue for the services to cover the cost of providing the service. If that's the case, we're able to try and negotiate with third-party payers, like insurance companies or maybe Medicare or Medicaid, and explain to them why we need additional funds to support this service. And like we talked about earlier on in the course, if we have accurate and quantifiable data that supports our position, it tends to make this negotiation process a lot easier. There's 4 key steps that we recommend when it comes to implementing ABC at an organization. And I give this disclaimer a lot, but keep in mind, this is just a framework. So different organizations who implement ABC might have more, less, or maybe just different steps in terms of how they bring ABC to life at their company, so to speak. But again, this is just a guide, so organizations should definitely modify and right-size it for their particular business. But the first step is to identify the cost centers that exist at an organization. And a cost center is a unit. It's something like a department or maybe a service line where costs originate. So in the context of a healthcare organization, these could be things like operating rooms or maybe radiology or physical therapy departments, just to give a couple examples. But depending on how and what you want to track, you would identify those cost centers that you're ultimately going to compare against each other in terms of total costs and ultimately profitability. Secondly, you want to determine the total resource costs for each cost center. And keep in mind here, this will likely include a mix of both direct and indirect costs. So to give a quick example specific to the radiology department, those costs might include things like the salaries for radiologists and the technicians, equipment depreciation, medical supplies, and utilities that go into running the machines. For this third step, we're going to take costs from each cost center, and they're going to be allocated to specific patient services based on actual usage or consumption. So the cost drivers, in a few examples, might be things like the number of patient scans, surgical minutes, or maybe the nursing hours that a nurse spends with a patient. But either way, the cost centers will determine how much of each cost center's expenses get assigned to different departments or procedures, again, depending on what you want to measure. So this is a little bit similar to what we did in the previous lesson when we were spreading the cost of our support departments to the primary care departments. And the last step is to calculate the cost per patient or procedure, again, depending on what you're trying to measure. And if we were tracking something at the patient level as an example, we might figure out that a patient required 1 MRI, 2 lab tests, and an hour of nursing care in total. And that comprised all the services that we gave to this patient. What we would then do is add up all those costs for the patient and determine how much total cost we actually took on as a result of bringing that patient into our business and taking care of them. So when we have this level of data, it allows senior managers to make more informed decisions about things like pricing, reimbursements, and the overall efficiency of our facilities and departments.